Okay, just for a second, picture the sound of a high-speed crash, or that sudden, gut-wrenching impact from a serious fall. In that absolute chaos, a hidden clock starts ticking. This is the story of that first hour, a story of survival, fought minute by minute in the world of orthopedic trauma.
So what really goes down in that so-called golden hour? It's not chaos, not really. It's an intense, coordinated race against time where every single second is a battle between life and a devastating, life-altering injury. Let's pull back the curtain on the emergency response that kicks off the second that high-energy impact happens.
Everything starts right here, with a massive, violent release of energy that, let's be honest, the human body just was not designed to handle. This is the source of the trauma, the single event that sets this whole life-or-death chain reaction in motion.
Now, we're not talking about a simple trip and fall on the sidewalk. The really severe orthopedic trauma, that comes from events with immense force. Think car crashes, motorcycle accidents, or falls from a serious height. And here's the really crucial point. The impact is so extreme that doctors automatically assume there's a huge risk of life-threatening damage to the spine or internal organs. It is never, ever just about the bones.
All right, so the patient has just been rolled into the emergency room. That clock is ticking louder than ever, and a highly trained trauma team just springs into action. It's a systematic, almost choreographed response. It's incredible to watch.
So the team is immediately taking a snapshot of the patient's condition. They might see what's called a comminuted fracture, which is just a way of saying the bone is shattered into multiple pieces, or an open fracture, where the bone is literally punched through the skin. But even more critically, they're looking for signs of shock. Things like dangerously low blood pressure, that's hypotension, and a critical loss of blood volume, known as hypovolemia. Basically, they're seeing a body in full-blown crisis mode.
In the middle of all this apparent chaos, there's a very clear, methodical plan. It's called the Advanced Trauma Life Support, or ATLS protocol. You can think of it as the universal language of emergency medicine. Before they even think about fixing a specific broken bone, the team's entire focus is on the ABCDEs. That's airway, breathing, circulation. The goal is to resuscitate the patient and stabilize anything that poses an immediate threat to their life.
And this leads us to a core philosophy in trauma care that might actually sound a little backwards at first. The mantra is stabilize the patient now and worry about the perfect, permanent fix later. In these first critical moments, survival is the only thing that matters, full stop.
This whole philosophy is put into practice through something called damage control orthopedics. See, when a patient is way too unstable to survive a long, complex surgery, surgeons will opt for a temporary fix. The best analogy is emergency scaffolding for the body. They use an external frame, pins, and bars to hold the broken bones roughly in place. It's all about buying precious time for the patient to get stable enough for the real repair down the road. So you've got this crucial two-stage approach. First up, damage control. That's all about using those external frames for temporary stability while the patient is still really fragile. It's only later, once the patient's vitals have stabilized and they're out of immediate danger, that the team can move to stage 2, definitive fixation. And that's the permanent repair, using internal plates, screws, or nails to put everything back together perfectly.
Okay, so the patient is stabilized, the immediate life threats are under control. But the battle is far from over. A whole new phase begins now, one that's all about anticipating and managing the dozens of complications that can pop up after such a massive shock to the system.
And yeah, the list of potential risks is long, and it is serious. We're talking about severe blood loss, life-threatening blood clots, massive infections like sepsis, and even long-term problems like permanent nerve damage or arthritis. But there's one complication on this list that's really unique to major bone fractures.
It's called fat embolism syndrome. And it makes sense when you think about it. The marrow inside our big bones, like the femur, is really fatty. When one of those bones shatters, little droplets of fat can actually escape into the bloodstream and travel all over the body, clogging up tiny blood vessels in the lungs and brain. This can lead to this really dangerous trio of symptoms: major breathing problems, confusion or neurological changes, and a very specific telltale rash of tiny red spots. It's just a perfect example of how an injury to one bone can cause devastating problems for the entire body.
So, with all these potential dangers flying around, how do doctors and nurses quickly figure out what needs to be fixed right now? Well, they use a mental checklist of red flags, the absolute must-fix immediately orthopedic emergencies.
And here it is. It's a simple mnemonic that literally saves lives. Von Chop.
Each letter stands for a condition that needs immediate action to save a limb or even the patient's life. Like V for vascular compromise. That means the blood supply to a limb has been cut off. Tissue can die in a matter of hours. Or P for an unstable pelvic fracture. That's a huge deal because the pelvis protects major blood vessels, and a fracture there can cause massive, hidden, and often fatal internal bleeding. This little tool brings order and priority to an incredibly chaotic situation.
So you see, what looks like pure chaos in the ER is actually a highly organized, methodical process. From that first ATLS protocol, to the strategy of damage control, to being vigilant for red flags like VO and CHOP, every single step is designed to pull a patient back from the brink. It's truly a testament to finding control in the face of absolute catastrophe.
So that first hour has passed. The protocols have worked. They brought control to the chaos, and the immediate physical threats are being managed. The body is stabilized. But now, the true, much longer journey begins. Because a trauma like this is about so much more than just broken bones. So, what's the first step to actually healing the whole person after an event like this? Well, that's a question that goes way beyond the emergency room.